Hey guys, I'm Andy Austin. I'm a nurse practitioner and I work in interventional pain management for the past 19 years. I take care of a lot of people that has lower back pain. And so I decided to put this talk on. Hope you find something you like, you learn something. If you do like it, give me a thumbs up or subscribe, because we're going to probably start rolling out some other common pain problems. But yeah, if you think of anything you want us to cover, leave a comment below. So typically when people come to see us with lower back pain, they've been seeing their primary care doctor, maybe started some physical therapy, and when the pain persists, they come to see us. So I have this talk with them to kind of give them an idea on what they're dealing with, particularly with discogenic lower back pain. Now, in general, as far as musculoskeletal is concerned, there's 4 causes of musculoskeletal lower back pain. It's disc problem, joint problem, muscle problem, or a combination of all the above. There's all dozens of different types of lower back pain problems, but we're focusing on musculoskeletal. And today we're going to talk specifically about discogenic lower back pain, because that's the one that really affects people early on and is a progression usually. Discogenic lower back pain can be really brought on by obesity, sedentary lifestyle, occupational work habits, and genetics too kind of plays a role in that. So what is discogenic lower back pain? That's when lower back pain is coming from the disc itself, okay? Very common example of this is someone in their early 30s, late 30s, maybe early 40s, a little overweight. They've done the same thing they've done normal day to day, maybe working out in the yard, not a whole lot of heavy lifting, but they bend over at the waist and pick something relatively light up. Boom, it hits them in the lower back and they're down for several days afterwards. I thought it'd be interesting to teach you, if that's discogenic lower back pain, what's going on and what happened. So this is what happened. So if it's discogenic lower back pain, when you have that sharp pain in your lower back, that's from an annular fissure, okay? That's what we call it, okay? Or annular tear, all right? So the best way to explain it is to show it. So if we was to cut you in half, okay, and look down from the top, okay? This is the top we're looking down at. The disc is made up of 2 parts. The nucleus, which is the green, and the nucleus is like a thick gelatinous material that kind of gives the spine its axial stability and support, okay? And then the second part of the disc are the annular rings, which are like rings of a tree, okay? And in between those rings is water, fluid, okay? And the rings provide 2 functions mainly, which allows the spine that bend and flex and moving, but also it encapsulates the nucleus, keeps the nucleus well contained, okay? So what happens is you're working out in the yard and you bend over at the waist, boom, your back goes out. My back went out. Well, what can happen, what can be a cause of it, is a tear in the annular rings. Well, these rings will crack and tear, okay? And how bad the tears are really depends on how long it takes you to get over it. Typically if you talk to people that are in their late 50s or early 60s, and you go back over the history, they started having times where their back would go out in their late 20s. And what would happen is they were picking up something heavy or something maybe not even heavy, and their back went out. It'd take them 2 or 3 days to baby it, take some over-the-counter stuff or time, and it just kind of got better, okay? During that time, it was kind of painful to sit or stand, which is the 2 hallmark pain associated with discogenic lower back pain. Pain with sitting's number 1. If you have patients that come in and they say, you know, I can stand and walk pretty good, but I cannot sit in my car. I just got to get out of my car. That's a red flag for this is most likely a discogenic source of their pain, at least part of it. So then as they progress in age and they continue to do what they normally do, maybe continue to gain a little weight, less active, their core muscles are weaker with time, then you start, if you go back over the history of these times where their back goes out on them, what you'll notice is those times when their back do go out, it gets a little bit longer and a little bit longer and a little bit longer to get over. And all of a sudden they have one episode where boom, now they start having pain, burning pain down their leg, okay? And that's when, you know, they decide, hey, I gotta go, if not before, but that's when they start having pain going down their leg, they're saying, okay, this is something not right, I gotta get this treated. So this is what happens. You have the cracks in the annular rings. When those annular rings crack or fissure, your body releases chemicals that it detects as pain, such as prostaglandins and histamines, that type of stuff, and that's what allows the body to say, hey, we have pain here, we're gonna lock down. You're not gonna wanna bend and twist, and you're not gonna wanna sit. And over that recovery period, then the body usually heals and metabolizes those chemicals out, and the pain kind of settles back down. You're able to get back to your normal activity. A lot of times when people come see us, we want them walking because that stimulates circulation. It improves, if they're having any leg pain in particular, it improves the connection of that nerve root. But going back to this, say they've had recurrent pain problems where their back had gone out, and now they're mid-50s, and now they're having their back pain. It's not gotten better like it used to with rest and babying it and oral anti-inflammatories and over-the-counter stuff. And oh, by the way, they're having pain down their leg. Well, what has happened is when those annular fissures crack, annular rings crack, they heal back, but they can heal back a little bit weaker, okay? So it takes a little less and a little less to have that recurrent injury, okay? So what happens is they start not doing as good enough job keeping that nucleus well contained. So that nucleus starts trying to migrate around, okay? So if this is the front and this is the back, when you bend forward at the waist, it's like stepping on a water balloon, you're exerting more pressure out the back, right? So what'll happen is those rings heal and they don't keep that nucleus as good enough place. What'll happen over time is that nucleus will start trying to migrate, and what usually happens for them when they come see us when they have the leg pain is that nucleus material will herniate all the way through. That'll be all, and that's a herniated disc. Actually, it's herniated nucleus pulposus. That's the fancy word for it. All that means is that nucleus material has squirted through the annular rings, and now it's occupying space. It's putting pressure on a nerve root or getting close to a nerve root. That's close enough to cause problems and pain at times. The reds, the nerve roots that come out the back. That black line denotes a bony encasement. So there's not much room there to accommodate extra nucleus of a disc, nucleus material, okay? So that's what happens, okay? So things like physical therapy, things like McKenzie exercises, things like lumbar traction, you may have tried before. The reason why they do that is it does the exact opposite whenever you're sitting in the car, okay? Say, for example, you have back pain and you're able to get up and get around okay, but you go sit in your truck or vehicle and you drive 45 minutes to work and you start noticing your leg going to sleep and you got to get out the car. Well, what's happening is you have enough space But the longer you sit, that disc bulges a little bit further back, okay? So what I tell people all the time is MRIs are the gold standard of what we use every day with this type of problem. But in some people, particularly the younger folks, when you still have some fluid in here, you're laying flat on your back for 30 to 45 minutes in an MRI machine. Let's go do an MRI if you could sit in a car for an hour. And what you'll see, I'd be willing to bet, that goes along with your symptoms get worse. So 3 or 4 millimeters either way is like a mile in your spine. It's a big difference. So that's when you go see therapists or chiropractors, they'll try lumbar traction. And lumbar traction does the opposite of prolonged sitting or standing. They flip you upside down, use gravity pull, and you open that disc space up, okay? And so it creates a negative vacuum, negative pressure, and it hopefully tries to suck that disc material back where it needs to go, off that nerve root. That's all they're trying to do, guys. That's all they're trying to do is get it off that nerve root, okay? So if you look over here, what this shows is a side view of your spine, okay? These are bony cubes. They form little wings it's like a dovetail joint. Those are a joint. This is a normal side view of a disc. You see how nice and space that disc causes? Okay, you also have a good amount of space for that red nerve root to come out of. You see the space around it, plenty of space. Well, you hear about people having degenerative disc disease. Typically what that is you have fluid over time. The fluid that you have in between these nice rings, just like other things when you get older, you start losing it, okay? And it starts decreasing in height and starts bulging, okay? And so what happens is you start losing disc height, okay? And so that disc material has to go somewhere, and it's going to go backwards. So you start having disc bulges, okay? The disc material starts bulging backwards, okay? So it's not necessarily a herniation. In other words, that nucleus is not necessarily herniated out. It's just you have less fluid. It's not nice and round anymore. So as you start to age, it starts to kind of get flatter and starts bulging backwards, okay? So that can cause problems such as this, and that's what lumbar traction helps as well. So what we want to make sure and do is when you have these type of problems early on, identify, go see your primary care, go see your doctor or practitioner, talk with them about it. It's hugely important, particularly if you're young. If you're real young and if you look back and mom or dad or sisters or brothers have back problems already, or, oh, damn, my dad's had 2 back surgeries, my mom's had 1, et cetera, just like heart disease, man. You know, you may have some genetics working against you. So early on, now's the time to take the modifications, lifestyle modifications, to protect your back. And that's walking, making sure you're under a good weight. And this is a common thing too, is, you know, you can go anywhere and they'll say, well, you need to lose weight, you need to lose weight. But they never really tell people why. And the reason why is studies have shown that if you're able to take 1 pound off your abdomen, it's equivalent to 7 pounds of pressure off your back. And one time I had a lady that was struggling, and she said, you know, I feel so upset that I only lost, 6 pounds. And I said, that's awesome. That's great. Congratulations. And she kind of looked at me like I was crazy because she'd been trying for 3 months, 4 months. I said, no, do you realize that's like you're no longer carrying around a kindergarten or a preschooler on your back anymore? I mean, that's huge. That's awesome. So little benefit, little changes will make huge difference down the road, okay? So basically that kind of gives a rundown on discogenic lower back pain. I hope you liked it. If you have any comments, leave them down below. Like I say, if you like this and you want to learn some more about common pain problems that just about everybody who deals with it one time or another in their life, subscribe. Again, thank you so much. When in doubt, go see your provider, get checked out. We're not establishing any type of client provider relations. Go see your family doctor, get healthy, walk, be careful where you're lifting things. And that's it. We out. Thanks.